In this video, we'll discover about the importance of joint health. Every time you sprint to catch the bus, score a point against your opposing team, or shoot pool with friends, you're using your extremely functional musculoskeletal system. This means a combination of bones, joints, and muscles get you going where you want to go. But muscles and bones don't work alone. Instead, there are joints that link these together. While bones support your body's entire weight, your muscles pull your bones as you move. Joints are the connecting links that put both bones and muscles in motion. Given the important functions of mobility and movement, it becomes crucial that you take good care of your joints. After all, you put them through so much wear and tear throughout your life. Joints that aren't well taken care of become susceptible to injury, inflammation, and general dislocation. As age catches up with you, you can feel the effects of overuse weathering away your joints. So keep your joints healthy at every stage of your life so they can keep you moving even in old age. But before we look at ways to do so, here's a quick look at the anatomy of a joint so you can better understand what goes into keeping your joints healthy. What are joints? Imagine if the skeleton had only one solid bone. That would make it very difficult to move. So instead, nature solved this problem by dividing the skeleton into many bones and creating joints where the bones intersect. Joints are also known as articulations, forming strong connections that join bones, teeth, and cartilage to one another. Now you have the freedom of movement in different ways and directions. Some joints open and close like a hinge, such as your knee and elbow, allowing you to straighten or bend your legs and arms. You sit down, stand up, pick up, and put down stuff using these joints without giving it a second thought. Other joints are meant for more complicated movements, such as your shoulder or hip joint. These allow for forward, backward, sideways, and rotating movements. Just think of everything you can do with these joints, and you'll get an idea of how limited your movement can be if any of these joints suffer damage. But not all these joints are created equal. For instance, while joints like the knees provide stability, others like the wrist, ankles, and hips let you move, glide, skip, or run. And just as their functions vary, so do their anatomy, which means that you also need to take care of them in specific ways. Some joints are purely made of tough collagen fiber, while others have cartilage binding bones together. Yet others have something known as synovial fluid in between cartilage pads and the end of articulating bones. So while you may think that all joints can be maintained using the same methods, you may need to rethink your joint health strategy. Let's first take a look at the different types of joints found in the body before discussing how to take care of them. Types of joints and their functions. Each joint is specialized in its shape and structure to control the range of motion between the parts it connects. For easier understanding, you may classify joints based on the function they perform or how much movement they allow. You can also do the same based on the structure of the joint or the material that is present in the joint. This means looking at how the bones are attached to one another. Both categories will let you divide joints into three broad classes. 1. Immovable or fixed joints. These are typically fibrous joints that are held together by dense fibrous connective tissue. Think about the bony plates of the skull to get an idea. There are links or joints between the edges of the plates made of fibrous tissue. The point is to make them immovable and protect the brain. 2. Slightly movable or cartilaginous joints. There are bones that are held together by cartilage and allow for some degree of movement. An example could be the spine, where each vertebra is linked by cartilage. With this arrangement, every vertebra moves in relation to the one above or below it, giving the spine its flexibility. This lets you bend forward, backward, or sideways without straining your back. 3. Freely movable or synovial joints. This third type is the most abundantly found in the body. Here, joints have a synovial cavity that contains a fluid. This synovial fluid lubricates the areas that help the joints move easily. This type of joint allows the greatest range of movement, letting you propel yourself in just about any direction. Examples include your elbows, knees, hips, and shoulders, among others. Synovial joints can further be divided into 6 types, including the following: hinge joints, such as the fingers and toes, ball and socket joints, such as the shoulders and hips, pivot joints, such as the neck, gliding joints, such as the wrist, saddle joints, such as the thumb, planar joints, such as the ankle. Healthy versus painful joints. Unlike many other health conditions where it's not always possible to detect early warning signs of wear and tear, your joints are a different story. In fact, one of the first places where you feel your age is in your joints. In most cases, joint tissues generally develop over time and can make it hard for you to get around in everyday life. When things are going well, you won't feel any discomfort or pain, but if your joints start to give way, you may experience some of the symptoms discussed here. The foremost among these is experiencing joint pain. This may mean you're exerting your joints too much or that you've already worn them out a fair bit. If your joints become sore or tender to touch, it could indicate possible internal inflammation. Remember that inflammation isn't always visible to the eye and may continue for a while internally before symptoms become apparent externally. Likewise, if you experience slow mobility and movement because your joints hurt, consider it another red flag. And if your joints offer little flexibility with reduced range of motion, you may want to get a professional's opinion. Another telltale sign of joint health deterioration is creaking joints. If you hear clicking, creaking, or cracking sounds, or feel that your joints grate every time you move, you should become concerned about possible joint damage. Plus, you should also beware of your joint health if you happen to be overweight. Among other things, excessive weight is also associated with increased inflammation, a leading cause of joint discomfort. If your work involves taxing your joints, such as lifting heavy objects or even sitting for prolonged periods, you can start to develop joint issues as well. And finally, if you or your family has had joint issues in the past, you may be more susceptible to developing certain joint-related conditions. In this video, we'll have a look at common joint problems. A common source of joint discomfort is inflammation. In fact, many people associated with joint pain stem from inflammation. This can cause joints to become inflamed, swollen, stiff, and even rickety when cushioning in the area gets affected. Here's a look at some of the most common issues causing joints to become inflamed and painful. Arthritis. Arthritis, despite being very common, isn't well understood. It's not a single disease, but a name given to a group of about 200 problems that affect the joints. The root cause behind all of these problems is inflammation of the joints. Arthritis can affect people of all ages, but is most common in women and older individuals. The common symptoms that you can experience during arthritis are pain, swelling, decreased mobility, and stiffness. Symptoms can range from mild and moderate to severe. As arthritis worsens, you may find doing everyday tasks a nuisance. Inability to climb the stairs or bend down is common symptoms of progressed arthritis. Osteoarthritis is arthritis that occurs when wear and tear of cartilage takes place. Being the most common type of arthritis, this problem is characterized by excessive pain and stiffness. As the cartilage wears away, there's no cushion left for the bones, so when you move, the bones run against each other, and this friction causes the feeling of discomfort. If the problem persists, the condition can get worse and joint strength is lost. The risk factors for this problem are obesity, age, and any previous injury. Anyone with a family history of osteoarthritis is also likely to get it at some point in their life. Arthritis can impact any set of joints, but its effects are felt most in the hips, knees, neck, back, or the hands. Another example is rheumatoid arthritis, which is a kind of autoimmune disease. In this condition, inflammation increases in the body, which causes joint damage and pain. Risk factors include genetic and environmental reasons. For example, smoking is a risk factor that can cause rheumatoid arthritis in specific people who have a particular gene. The aim of medication that is given for treating this disease is to increase mobility and reduce stiffness. Arthritis is diagnosed by a physician by doing blood testing and taking some imaging scans. If the problem gets bad, an orthopedic surgeon performs joint replacement surgery. Arthritis may also affect other parts of the body when it progresses, so other specialists like dentists and ophthalmologists may also be needed. Gout. While the knees, neck, and shoulders are spots more susceptible to joint pain, gout presents itself in the big toe of the foot. It's a very common type of arthritis that can cause stiffness in the area, which is accompanied by excessive swelling and intense pain. While it's common in men, women who have reached menopause also become more susceptible to gout. The cause of this joint problem is the deposition of uric acid in the bloodstream. This could be due to two reasons. Either there is too much uric acid production, or the kidney is not able to efficiently remove uric acid from the body. Inflammation resulting from excess of uric acid crystals in the blood is the prime cause of this problem. Gout attacks are specific and quick, mostly occurring in the middle of the night. Medication is used to treat gout problems. It is used for reducing the symptoms and preventing future attacks. Since gout, if it gets worse, can also cause kidney stones, medication is used to prevent the situation from getting any more complex. Bursitis. Bursitis is an inflammatory condition that affects the bursa. The bursa is a sac that is filled with fluid present between the skin and the joints. As it is present above the joints, it acts as a cushioning agent between bones and tendons. Common symptoms associated with bursitis are swelling and tenderness. Bursitis mostly occurs in elbows, knees, hips, and shoulders, but other areas in the body can also get affected. Bursas become inflamed when there is a repetitive movement or injury. If you indulge in any sports or physical activity where you are performing repetitive activities on a daily basis, your chances of getting bursitis increase. For example, if you bowl every day, you may get elbow bursitis. People who spend a lot of time on their knees, such as gardeners, are also prime victims of knee bursitis. Sometimes bursitis may even be caused as a development in another arthritis condition such as gout. Bursitis can also be treated at home. Easy treatment methods for bursitis are forming a cold pack or resting the area. Also, painkillers such as paracetamol can also help speed up the recovery process. Although the pain goes away in a few weeks, swelling lasts for a longer time. To prevent bursitis, it's important that you wear knee pads when you are playing and always warm up before exercising. If your symptoms are not getting better at home even after 10 to 14 days of treatment, then seek medical help. Repetitive movement injuries. Repetitive motion or stress injuries could be permanent or temporary injuries that cause damage to the nerves, tendons, or ligaments. These injuries occur when you are doing the same thing again and again. For example, if you're playing a sport in which you do the same motion repetitively, then you're likely to suffer from a joint condition. Carpal tunnel syndrome is a common form of such injury. It is caused by a disorder of the tunnel that runs from the forearm to the wrist. When the ligaments and tendons in this area get compressed, swelling and pain are experienced. This type of repetitive movement injury is common in people who type on computer keyboards on a daily basis. This injury can cause a lot of pain. Numbness and lack of motion is also associated with this joint problem. If it persists over time, the sufferer loses flexibility in the region. If treatment is not done, the end result is complete loss of friction. Of the two hands, the dominant hand is more prone to this problem, and women are 3 times more likely to get carpal tunnel syndrome as compared to men. People suffering from wrist trauma or diabetes are also at a greater risk of getting this problem. Rehabilitation programs for repetitive movement injury includes occupational therapy and pain management techniques. Heat and cold applications at home can also help. Exercising the affected areas helps to strengthen it and prevent any complete loss of mobility. Primary care doctors, medicine doctors, sports doctors, and orthopedic surgeons are involved in treatment of repetitive movement injuries. It is always best to get help before the condition gets any worse. In this video, we'll discuss about balance your diet. If you don't lead a healthy life with a balanced diet, health issues will catch up with you sooner than you'd like. There's always room for improvement, and you can start making changes in your diet at any point in your life. A joint-healthy diet helps keep away pain, stiffness, and reduced mobility. Nutrients that nourish your joints. The food you eat contains different nutrients such as fats, proteins, fiber, vitamins, and carbohydrates. The 2 most important nutrients for joint health are minerals and vitamins. The most notable among these is perhaps calcium, which keeps your bones strong and can prevent osteoporosis due to lack of bone density. But while many people give calcium the kudos it deserves for bone and joint health, they often forget about magnesium. However, the truth is that calcium needs to be paired with magnesium and even vitamin D to be most effective. You need to have a good balance of all three, as each is independent of the other for optimal performance. For instance, while calcium promotes bone density, magnesium assists the transport of calcium across cell membranes. At the same time, magnesium promotes enzymes that convert vitamin D to its active form, which, in turn, helps the body absorb calcium better. Magnesium also plays a role in strengthening bones and maintaining cartilage. It also regulates nerve and muscle function, ensuring that everything is under control. Studies have shown that magnesium prevents degradation of bones and increases bone density. It's also been found to be effective against postmenopausal osteoporosis. It's also been seen that people with joint issues often suffer from low levels of vitamin D as well. When studied, vitamin D seems to ward off conditions like osteomalacia or soft bones or osteoporosis, resulting in loss of bone mass. Supplementing well with this vitamin may help you take better care of your bones and joints. Another vitamin that deserves attention in this area is vitamin C. As one of the most powerful antioxidants, it can help prevent oxidative stress in the body. Oxidative stress also harms the synovial membrane in joints, causing the synovial fluid to leak, compromising joint lubrication. Here, vitamin C can provide cushion and lubrication to the area by preventing oxidative damage. Best foods for joint health. Naturally, the best foods for joint health will include these aforementioned nutrients along with others. If you already suffer from joint-related conditions, then altering your diet may actually help reduce your painful or discomforting issues. For instance, there are some foods that can actually help reduce the effects of arthritis and also give relief from pain. Many patients suffering from arthritis admit that changes in their diet plan have helped reduce the severity of their symptoms. One of the best foods to eat if you have painful or inflamed joints is fatty fish. Salmon and sardines are rich in omega-3 fatty acids. Omega-3s reduce inflammation in the body, and it's been found that in the presence of this fatty acid, the amount of inflammatory mediators is also low in the body. Incorporating omega-3s in your diet will reduce morning stiffness, provide pain relief, and cool down your body. These fatty acids are especially helpful for people with rheumatoid arthritis. Garlic is also very important for people suffering from painful joints. Its immune-strengthening properties make cells stronger and can target inflammation as well. By lowering the amount of inflammatory markers in the body, garlic helps lessen the pain associated with arthritis and similar conditions. Likewise, ginger is also very effective in reducing pain from knee arthritis. A very easy way to incorporate these two foods in your diet is to make a garlic ginger paste and use it for flavoring in your meals. Broccoli is not only effective for keeping your weight in check, but also great for joint health. It's involved in blocking a certain type of cell that accelerates the progression of rheumatoid arthritis. Walnuts are also anti-inflammatory in their effect, and they may even reduce the need for painkillers. If you are an arthritis patient who loves berries, then you're in luck because berries also reduce inflammatory markers associated with arthritis. Whether it is blackberries or strawberries, all kinds are great for joint health. Spinach is another green that helps promote joint health. It's been seen that it prevents the progression of osteoarthritis. At the same time, it also improves cartilage health and reduces inflammatory agents that cause rheumatoid arthritis. Another fruit for fighting joint pain is grapes. The outer covering of grapes contains resveratrol, which has antioxidant properties. Grapes also slow down the thickening of joints and block the production of cells causing rheumatoid arthritis. You can also prepare your meals in olive oil to promote the health of your joints. Foods to avoid. There are some foods that you need to avoid in order to prevent progression or worsening of joint pains. Firstly, fried foods and processed edibles are a huge no for anyone with painful joints. This food makes the body's defenses poor and cause inflammation. When you cut down the intake of such foods, the body's natural defense system gets restored. Instead of eating frozen foods, cook at home and try to go for greens and fruits. Even foods cooked at high temperatures can make your body more prone to arthritis, so opt for more suitable recipes. AGE, or advanced glycation end product, as they increase in the body, can cause inflammation. These are produced when you eat grilled or heated foods. The body activates cytokines that cause inflammation in response to fight these compounds. As a result of that, the overall level of inflammation increases in the body, causing a risk of joint pain or deterioration. Cut down on these foods so that blood AGE levels can be low. You might love nibbling on cheese slices, but this isn't healthy for your joints. Dairy products contribute to joint deterioration due to their protein content. Proteins present in dairy products can irritate the surrounding tissues of joints in many people. You can get the same proteins from other sources without the side effects, so it's advised to switch to a restricted dairy diet. Corn oil is present in many snacks and some baked goods too. It gives a pleasant taste to food but can trigger inflammatory markers to go in action and increase the risk of joint pain. This is because corn oil is rich in omega-6 fatty acids. Instead of eating omega-6s, you could try using oils rich in omega-3s, such as olive oil and flaxseed oil. Some cuts of red meat can also exacerbate inflammation as they are rich in saturated fats. Also, excessive consumption of red meat can cause obesity, which is another factor contributing to joint pain. Experts say that gluten can also cause inflammation in people who are already suffering from an autoimmune disease such as rheumatoid arthritis. Although alcohol doesn't really count as food, increased intake can lead to deterioration of joint health. A controlled amount of alcohol can actually prevent RA, but the problem begins when you start drinking too much of it. Overconsumption of alcohol leads to production of a protein called C-reactive protein, which is a signal for inflammation. So it can worsen the cases of rheumatoid arthritis. Balancing your diet is the first step towards improving joint health. In this video, we'll talk about watch your weight. So now that you know that one of the factors affecting joint health is lack of physical activity, what do you do about it? Well, you naturally start off with some form of exercise to improve joint flexibility and range of motion, but at the same time, you also have to watch your weight. When your body becomes too heavy to be supported by your joints and bones, problems start to arise. As such, you need to exercise and eat right to keep your body at an optimal weight. How weight affects joints. If you have a sensation of pain when walking for a while or climbing up the stairs and are worried because it runs in the family, then you should take a look at your weight. Being overweight increases your chances of getting osteoarthritis. As mentioned earlier, this condition is caused by the wear and tear in joints and is the most common form of bone degradation. When you're overweight, there's an extra stress on the joints that bears your weight. The most common of these joints is the knee joint, and it's the first one to get affected by excess weight. The second reason why weight is detrimental for joints is that as your weight increases, the inflammatory markers in the body also increase. This further causes joint deterioration in other places, such as your hands and neck. The extra pounds in your body stressing your joints can lead to degeneration of cartilage and joint damage. In cases of osteoporosis, being overweight also increases the rate of bone degeneration. By shedding weight, you can protect your joints from excess stress and any further damage. Experts suggest that you should lose about 10% of your body weight and then see if the symptoms improve. If they do, then it's your weight causing the problems in the first place. Obesity further reduces any physical activity, which becomes another cause for joint issues in the long run. If you already suffer from an extreme case of arthritis, high-endurance exercise can also cause damage to your joints. So it's important to get guidance from an expert about the kind of exercises you can and should do. In osteoarthritis, sitting for extended periods of time causes stress on the joints and worsens the pain. If you have an office job, make it a habit to take a walk or do short exercises after every hour. You can also do these exercises on the spot. For example, sit and stand on the spot for a minute without using your hands as support. Keeping a pillow under your legs while you sit makes this worse, so avoid doing that. Reduce stress on joints. Weight loss is a great way to reduce stress on your joints. On average, the amount of pressure or stress on your knees is 1.5 times that of your body weight. So if you weigh 300 pounds, you're putting 450 pounds of stress on your knees. This is when you are in standing position. As the incline increases, the stress increases too. As such, when you climb stairs, there's more stress on your knees. If your knees are extremely close to the ground, like when you tie a shoelace, the weight increases to 3 or 4 times of your body weight. Experts say that just a 10-pound increase in weight increases 30 to 40 pounds of stress on your joints. The joints work fine while they are still young and healthy, but after an extended period of time, they give up. So just imagine that if you lose weight, how much stress you'll be able to reduce on your knees. When you're young, the body cells proliferate at a considerable rate. With age, this process slows down, so the damaged cells don't get repaired as quickly as they did during your youth. So start slow and you'll be able to lose the extra pounds very easily. Physical activity in the form of exercise is a proven way of slowing the progression of arthritis. Just like any machine, the body wears away if it's not being used properly. So put your muscles and joints to use so that they do not rot away. Every pound you lose represents about 3,500 calories. So if you're hoping to lose 1 pound in a week, you need to burn about 500 calories in a day. The exercise plan you follow must at least help you lose 500 calories in a day. Along with exercise, you also need to focus on your diet. Even if you're young and not arthritic, it's essential that you watch your weight to dodge this disease in a few years' time. Pay attention to your posture. It's a basic rule of thumb that good posture can save you from a lot of pain. Improper posture often becomes the cause of back pain and knee pain. Standing up straight is always a good way to keep your knees, legs, and back safe from stress. When you slouch, you increase the stress on your joints. As mentioned above, the closer your knees are to the ground, the more stress they bear. So when you stand, make sure there's no incline and you are straight to minimize stress on your knee joint. Whatever you do, it's important to have proper posture to keep your back muscles and knee joints safe. For example, if you're a student and you need to hold your backpack for a long time, sling it over both shoulders rather than just one. This divides the stress instead of concentrating it only on one side. Likewise, if you carry a handbag, keep changing your arms after a few minutes. Don't sling it on one shoulder for a long time, as that can damage the hinge joints in the region. Proper posture is essential because it also keeps your bones and joints aligned. When you have bad posture, this alignment gets disturbed and causes the joints to rub against each other. When this keeps happening over time, wear and tear starts to take place. Your spine takes the stress and starts presenting issues. If you have a kind of job where you need to sit for many hours, make sure you have proper posture. Shoulders should be over the hips. You should have good lower back support. Your computer screen should be at eye level so that you don't have to put strain on your neck to look at the screen. Keep your elbows at 90 degrees, and the pens or other things you may need should be in easy reach. When you have to tie your shoelace, sit in a chair and keep your foot on the opposite knee. In this way, you won't have to bend too far down. Bending too far increases stress according to the mathematical calculations explained earlier. So the idea behind proper posture and exercise is not only to keep joints healthy, but also to slow down the degradation process.